Occupational English Test. Listening Test. This test has 3 parts. In each part, you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information that you hear. Now, look at the notes for Extract 1. Extract 1, questions 1 to 12. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Doctor, I've been focusing a lot on improving my health lately. I managed to lose 7 pounds, aiming for a target weight of 167 pounds. It's been challenging, especially with my history of diabetes and hypertension. I've been using a nicotine patch and gum, along with some cessation medications to quit smoking. I slipped up and had a cigarette 2 weekends ago, but it tasted horrible, probably because of the cessation meds.
It sounds like you're making significant efforts to improve your health, which is excellent. Losing weight and quitting smoking are significant steps. Let's talk more about your experiences with your diabetes management. How have the classes been going?
The diabetes classes have been helpful. I'm learning a lot about how to monitor my glucose levels more effectively. I've noticed some fluctuations, though. I think it's because of my diet changes. I'm trying to have a big meal at lunch and just a salad for dinner to manage my warfarin better.
Good. Managing your diet is key in controlling them. How about your medications? Any issues with those or the new inhaler switch for your COPD?
The switch to Symbicort was because the VA changed their available medications. I haven't noticed any problems so far. It seems to work as well as the previous one. As for my other medications, I'm on quite a list, but they're managing my conditions. I'm especially keeping an eye on the furosemide. It requires me to take potassium supplements.
It's important to keep up with those supplements along with the furosemide to avoid low potassium levels. Let's also ensure we monitor your kidney function with your current medication regimen. Now tell me more about your recent fall and how you're recovering.
That was a bit of a scare. I slipped and broke my arm. I've been wearing casts, and the recovery is ongoing, but it slowed me down quite a bit. I'm careful to avoid another fall.
Recovery can be slow, but staying active within safe limits is crucial. And the shingles vaccine, is that something you're considering soon?
Yes. After having a mild episode of shingles, I don't want to go through that again. I understand the vaccine could help prevent a recurrence, so I'm interested in getting that done.
That's a wise decision. Vaccination is a good preventative measure. You mentioned earlier that you've also resumed taking fish oil for your lipid management.
Yes, my doctor advised me to start taking it again to help manage my cholesterol levels along with the simvastatin. It's just another thing on my list, but if it helps, I'm all for it.
Managing cholesterol is important, especially given your history with heart issues. We've done quite a few tests today to check on everything, including your potassium levels and diabetes control. Let's look at your results and see where we stand. Looking at your test results, Your blood pressure is well controlled at 132/86, and your heart rate is steady. Your respiratory rate and body temperature are within normal limits. Your oxygen saturation is at 95% on room air, which is good. Your hemoglobin A1C is at 7.5%, which indicates that your blood sugar has been moderately well controlled over the last 3 months, but there's room for improvement. Your fasting blood glucose is slightly elevated at 154 milligrams per deciliter. Your cholesterol levels show total cholesterol at 198 milligrams per deciliter, with your LDL at 120 and HDL at 35. Your triglycerides are a bit high at 210. Your potassium levels are stable, which is good given your furosemide use. Your kidney functions are within acceptable ranges with a creatinine of 1.2 and an eGFR of 61, which is something we'll continue to monitor closely. Your liver enzymes AST and ALT are normal, and your thyroid-stimulating hormone is well within the normal range. Your recent chest X-ray shows a stable appearance with chronic pulmonary patterns, and your echocardiogram shows normal left ventricular function with an ejection fraction estimated at 60%. No significant valvular abnormalities were noted. The plan will be to continue monitoring and managing your existing conditions with your current medication regimen. We'll introduce a new diabetes medication to further improve your glycemic control, schedule the shingles vaccine, and follow up in about 2 months to reassess your treatment efficacy. Does that sound good to you?
Yes, doctor, that sounds great. I appreciate your help in managing all these things. I'm committed to following through with the plan and continuing my efforts to improve my health.
Extract 2, questions 13 to 24. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning. I see you've been keeping up with your appointments and health checks. How have you been feeling lately?
Morning, doctor. Well, it's been a mixed bag, really. My memory issues have been more noticeable, especially towards the evening. My family tells me I get more confused as the day goes on. They mentioned something called sundown syndrome, and I'm worried about that. Other than that, my breathing hasn't been great either.
I understand your concerns about the memory issues and breathing. Let's take each one step by step. Can you tell me more about what happens in the evenings with your memory?
Sure, it starts with forgetting small things, like where I put my glasses or what I was doing a moment ago. But by night, I sometimes can't even recognize my bedroom. It's quite distressing. My daughter reads up a lot. She thinks it might be related to my past strokes, as mentioned in my MRI.
That's useful to know. We've seen before that evening confusion can be more pronounced in conditions like yours. It helps to keep the environment well lit and as stress-free as possible in the evenings. How about your breathing? You mentioned using a nebulizer.
Yes, the nebulizer helps a lot. I use ipratropium and albuterol. Without it, I feel very wheezy, especially in the mornings and when I try to be a bit more active around the house.
It's good that the nebulizer provides relief. Making sure it's used correctly and regularly is key. And your general mobility. How are things at home?
I live with my friend. She's in a wheelchair, but manages to be of great help. We support each other a lot. The VA nurse comes by a couple of times a week, which helps with the medications. My daughter wants me to consider more frequent home visits, but I prefer going to the VA for my checks.
Support at home is crucial, and it's great you have that. It's also good that you have a preference for your care. Maintaining some independence is important. You mentioned your daughter is quite involved?
Oh yes, she's very active in managing my appointments and discussing care options. She's been looking into additional support like homemaker services, but I'm not too keen on people coming in to clean just yet.
It sounds like you have strong support and clear preferences, which is great. Keeping a balance between independence and adequate care is the goal. Now, based on what you've shared and your recent tests, let's discuss your health management moving forward. Your vital signs are stable, which is good. Blood pressure at 120/80, heart rate of 78, and all other readings are normal. Your lab results are also reassuring. Your hemoglobin is good, which is excellent for your energy levels, and your kidney function is stable.
That's good to hear, doctor. I do worry about these things, especially with my past issues.
Absolutely, staying on top of these is important. Your MRI showed some old changes, but nothing acute, which aligns with what you're telling me about your memory. Managing these symptoms is about both medical treatments and daily routines. Given your concerns about evening confusion, we should monitor your cognitive function closely and adjust as necessary. For your respiratory issues, it's also crucial to maintain your inhaler technique, so let's make sure that's reviewed regularly.
That sounds good, doctor. I want to keep as active and independent as I can. I'll keep up with the nebulizer and follow the plans we discussed.
Excellent. I'll schedule a follow-up appointment for us to reassess how the medications are working and discuss any adjustments in care. It's important to keep a close eye on both your cognitive and respiratory health. And if there are any changes or if things don't seem right, I want you to come in sooner.
Will do, doctor. Thanks for helping me sort through all this. It's a lot, but I feel better having a plan.
You're welcome. I'm glad we could set a plan that fits your needs. Remember, our goal is to manage your health in a way that allows you the best quality of life possible. I'll see you next visit, or sooner if needed. Take care, and remember to keep that evening environment as calm and familiar as possible. It can make a big difference.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Now look at question 25.
Thank you for coming in today, Mrs. Smith. We've received your genetic test results, and I'd like to go over them with you.
Thank you, Doctor. I've been quite anxious about this.
I understand. The test results show that you have a BRCA1 gene mutation, which increases your risk for breast and ovarian cancer.
Oh no, what does that mean for me and my family?
It means that you have a higher than average risk of developing these cancers. We can discuss strategies to manage and reduce this risk, such as increased screening, lifestyle changes, and potentially preventive surgeries.
What about my children? Do they need to be tested as well?
Yes, your children may also carry this mutation. We recommend genetic counseling and testing for them to determine their risk and take appropriate preventive measures.
What are the next steps for me?
We'll start with a detailed risk management plan. This includes regular mammograms and possibly MRI screenings. We'll also discuss lifestyle modifications and other preventive measures. I'll refer you to a specialist who can provide more detailed advice.
Now look at question 26.
I want to update you on the new infection control protocols that we'll be implementing starting next week.
Thanks for the update. What changes are we looking at?
First, we've revised our hand hygiene policy. We now require hand washing with soap and water for at least 20 seconds before and after patient contact, in addition to using hand sanitizer.
Will there be new training for this?
Yes, we'll have mandatory training sessions for all staff starting tomorrow. Each department will receive an email with their scheduled times.
What about PPE usage? Any changes there?
Yes, we're enhancing our PPE protocols. All staff must wear N95 masks in patient care areas, and face shields are now mandatory during any aerosol-generating procedures.
Are there enough supplies for these changes?
We've secured additional supplies to ensure we have enough PPE for everyone. Please report any shortages immediately so we can address them promptly.
How are we handling patient isolation?
We've designated specific isolation rooms for patients with confirmed or suspected infections. These rooms will have clear signage and only essential personnel will be allowed entry, fully equipped with PPE.
What about visitors?
Visitation is restricted. Only essential visitors are allowed, and they must adhere to our PPE and hygiene protocols. Security will assist in enforcing these rules.
Now look at question 27.
How are you feeling today?
I'm doing better, I think. My leg still hurts, but it's not as bad as before.
That's good to hear. Let's review your progress. Can you tell me how the exercises are going at home?
I've been doing them twice a day, just like you showed me. It's tough, but I can feel it getting a little easier each time.
Excellent. Consistency is key. Your range of motion has improved since our last session. Let's see how you're doing with your balance. Can you stand on one leg for me?
Sure, here goes. Okay, I can do it, but I'm a bit wobbly.
That's expected at this stage. You're making good progress. Now let's work on some strengthening exercises. We'll start with some leg lifts.
All right, I've been practicing these at home too.
Great, your form looks much better. Remember to keep your back straight and engage your core. This will help prevent any strain on your back.
Got it. How long do you think it will take before I'm back to normal?
Recovery times can vary, but if you keep up with the exercises and follow our plan, you should see significant improvement in the next few weeks. We'll gradually increase the intensity of your exercises as you get stronger.
Now look at question 28.
We're here to review Mrs. Thompson's progress and coordinate her care plan. Dr. Lee, can you start with her medical update? Certainly. Mrs. Thompson has been responding well to the new medication. Her blood pressure is now within the target range, and her kidney function has stabilized. That's great to hear. Nurse Johnson, how is she doing with her daily activities?
She's been more active and is now able to walk short distances with a walker. However, she still needs assistance with some tasks, especially in the mornings.
Thank you. Physical therapy, what's your assessment?
She's showing steady progress. We've been focusing on strength and balance exercises. I recommend continuing the current regimen and adding some resistance training.
Noted. Occupational therapy, any updates?
We've been working on improving her fine motor skills. She's made good progress with using adaptive tools for daily tasks. I suggest introducing more complex activities to challenge her.
Great. Social work, how is her home situation?
Her family is very supportive. However, they express concern about managing her care long term. We might need to discuss additional home health support.
That's important. I'll look into arranging more home health visits. Any other concerns or recommendations?
From a dietary standpoint, she's following her meal plan well, but we need to monitor her protein intake closely.
Now look at question 29.
Mr. Carter, I've reviewed your sleep study results, and it appears you have moderate obstructive sleep apnea.
What does that mean exactly?
It means that your airway becomes partially or completely blocked during sleep, causing you to stop breathing briefly multiple times throughout the night. This leads to poor sleep quality and can affect your overall health.
That explains why I always feel tired. What can we do about it?
The most effective treatment is continuous positive airway pressure, or CPAP therapy. It involves wearing a mask over your nose or mouth while you sleep, which keeps your airway open.
Will it be uncomfortable?
It can take some getting used to, but many patients find it significantly improves their sleep quality and daytime alertness. There are different mask options, so we can find one that's most comfortable for you.
Are there other treatments if CPAP doesn't work for me?
Yes, there are oral appliances designed to keep your airway open, positional therapy to avoid sleeping on your back, and in some cases, surgery might be considered. Weight loss can also be beneficial if you're overweight.
What can I do to improve my sleep right away?
In addition to starting CPAP therapy, try to maintain a regular sleep schedule, avoid alcohol and heavy meals before bedtime, and sleep on your side. These steps can help improve your sleep quality.
I'll give it a try. When do we start with the CPAP therapy?
We can set you up with the equipment and show you how to use it properly. We'll also schedule follow-up visits to monitor your progress and make any necessary adjustments.
Now look at question 30.
Dr. Adams, I'm here to provide an update on Mr. Williams, who's participating in our clinical trial for the new diabetes medication.
Thank you. How has he been responding to the treatment?
Overall, he's responding well. His blood glucose levels have shown significant improvement, and he hasn't reported any serious side effects.
That's encouraging. Has he adhered to the medication regimen and study protocols?
Yes, he's been very compliant. He follows the medication schedule meticulously and attends all scheduled appointments. He's also keeping detailed logs of his diet and blood sugar readings.
Excellent. Any minor side effects or concerns that he's mentioned?
He did report occasional mild nausea, but it hasn't been severe enough to interfere with his daily activities. We've advised him on ways to manage it, and he's been following those recommendations.
Good. How about his overall health and well-being?
He's feeling more energetic and has noticed an improvement in his daily life activities. His weight has remained stable, and he's been maintaining a healthy diet and exercise routine.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear two different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1.
Hello everyone, welcome to today's detailed discussion on the intricate relationship between diabetes and cardiovascular diseases in clinical settings. I am Dr. Emily Stanton, a consultant endocrinologist specializing in diabetes management. Today, we will delve deep into how diabetes contributes to cardiovascular complications and the strategies to manage this dual burden effectively, incorporating evidence from recent scholarly articles, including those from Harvard. Let's begin by examining a case that underscores the clinical complexities we often face. Consider Mr. Thompson, a 63-year-old male with a long-standing diagnosis of type 2 diabetes and recent issues indicative of congestive heart failure. Mr. Thompson has managed his diabetes with oral medications for over 10 years, but has shown inconsistent compliance, particularly with diet and exercise. Upon initial assessment, Mr. Thompson's hemoglobin A1C was recorded at 8.9%, significantly above the optimal target of less than 7% for adults with diabetes. His cardiovascular examination revealed troubling signs, reduced ejection fraction and left ventricular hypertrophy, both of which are critical considerations in diabetic patients. The intersection of diabetes and cardiovascular disease is well established and multifaceted. Diabetes significantly heightens the risk of various cardiovascular complications, such as coronary artery disease, heart failure, and hypertension. This increased risk is partly due to the hyperglycemic environment typical in diabetes, which accelerates atherosclerosis by promoting oxidative stress, inflammatory responses, and endothelial cell dysfunction. For Mr. Thompson, our primary objective was to improve glycemic control as a strategy to mitigate cardiovascular risks. Research from Harvard Medical School supports the benefit of intensive glycemic management, indicating that each 1% reduction in A1C results in a 14% decrease in cardiovascular events. Based on this data, our team decided to adjust Mr. Thompson's medication regimen. We introduced a sodium glucose cotransporter 2 (SGLT2) inhibitor. This class of drugs not only aids in glycemic control by promoting glucose excretion in the urine, but also offers cardiovascular benefits, a revelation supported by several clinical trials. For instance, SGLT2 inhibitors have been associated with reductions in heart failure hospitalizations and have shown potential in slowing the progression of kidney disease in patients with diabetes. Additionally, we incorporated a dipeptidyl peptidase 4 (DPP4) inhibitor to further enhance glycemic control without the risk of significant hypoglycemia. DPP4 inhibitors function by boosting levels of incretins, which in turn increase insulin secretion and decrease glucagon release, thereby aiding in better glucose management. Beyond pharmacotherapy, we reinforced the crucial role of lifestyle modifications. Mr. Thompson was encouraged to participate in a structured diabetes education program that emphasized dietary management, regular physical activity, and effective weight control. Research underscores that such lifestyle interventions can profoundly improve cardiovascular risk factors, including hypertension, lipid profiles, and obesity. Over the following 6 months, Mr. Thompson's condition showed remarkable improvement. His A1C dropped to 7.1%, and his heart function indicators stabilized, illustrating the positive impact of a comprehensive, evidence-based approach to care. Managing diabetes in the context of cardiovascular disease requires a deep understanding of the interconnected pathophysiology of these conditions. Clinicians must adopt a holistic approach that combines the latest pharmacological advances with robust lifestyle interventions. Keeping abreast of ongoing research, such as the insightful studies from Harvard, is crucial for optimizing patient outcomes. Today's discussion highlights the necessity of integrated care strategies that address both diabetes and its cardiovascular complications. It is our hope that this information will serve as a valuable resource for healthcare professionals dealing with similar cases, fostering a greater understanding and improving patient care strategies. Thank you for your attention. This webinar aims to enhance your clinical practices and inspire further exploration into the comprehensive management of patients with complex health profiles, like that of Mr. Thompson.
Now look at Extract 2. Extract 2, questions 37 to 42. You now have 90 seconds to read questions 37 to 42.
Today, I want to delve deeply into the emerging model of same-day emergency care, DEEC, its implementation, and the complex challenges it addresses in our healthcare system. This model is particularly crucial for managing patients who need urgent medical attention but do not require a traditional hospital admission. Let's explore this through the case of Mr. Thompson, a 68-year-old patient with a history of hypertension and recurrent transient ischemic attacks, TIAs. Mr. Thompson recently experienced symptoms indicative of a TIA, sudden weakness in his right arm, and mild speech difficulties. Traditionally, such a presentation might lead to prolonged emergency department stays and multiple transfers within the hospital for various tests and consultations. However, under the SDC model, his care trajectory was markedly different, emphasizing efficiency and integration. Upon his arrival at the SDEC unit, Mr. Thompson was quickly assessed by a multidisciplinary team. This team, a cornerstone of the SDC approach, included emergency medicine consultants, advanced nurse practitioners, and diagnostic radiologists, all working in concert. This is in line with the model's aim to expedite diagnosis and treatment, thereby enhancing patient outcomes and optimizing resource use. The team conducted a comprehensive neurological examination and immediate diagnostic tests, including a CT scan and carotid ultrasound. These diagnostics are co-located within the SDEC, which drastically cuts down the waiting times and speeds up the patient's care process. The results showed no acute ischemia, but did reveal a significant carotid artery stenosis. Recognizing the urgency, the SDE team coordinated with the on-site vascular surgery team, and Mr. Thompson underwent a carotid endarterectomy within hours. This prompt intervention likely prevented a full-blown stroke, showcasing the SDEC's capability in providing rapid, decisive care. Post-surgery, Mr. Thompson was monitored in a recovery area within the SDC unit, underscoring the model's emphasis on streamlined patient flow. He was discharged the same day with follow-up appointments scheduled within a week, demonstrating the SDEC's role in bridging acute care and outpatient services effectively. This case illustrates several of the SDEC model's strengths. Firstly, the speed and coordination of care it provides are pivotal for conditions like TIAs where time is critical. Secondly, by managing cases that do not require prolonged hospitalization within the SDEC, the model alleviates pressure on traditional emergency services and hospital wards. From a systemic perspective, the integration of SDEC models can lead to significant improvements in healthcare delivery. Studies highlighted in scholarly articles from institutions like Harvard Medical School have documented that such models not only enhance patient outcomes, but also bolster the efficiency of healthcare systems. They manage to reduce hospital admissions for acute, manageable conditions, which in turn decreases healthcare costs and elevates patient satisfaction levels. However, the successful implementation of SDEC is not without its challenges. It requires substantial investments in terms of both infrastructure and staff training. The model necessitates a high degree of coordination and data integration across different hospital departments and services. It also demands a shift in organizational culture from a segmented department-focused approach to a more collaborative, patient-centric strategy. The broader implication of adopting SDEC systems, as seen in Mr. Thompson's case, is quite profound. It represents a paradigm shift in how acute medical care is delivered, moving away from a prolonged reactive, segmented system to a proactive, integrated approach, improving patient outcomes. This transition is pivotal for the sustainability of healthcare systems facing increasing patient numbers and finite resources. As our experience with Mr. Thompson shows, the SDEC model not only addresses the immediate needs of patients with acute conditions efficiently, but also integrates care across various health services to provide a continuum of care that traditional models struggle to offer. While there are hurdles to its widespread adoption, the potential benefits, improved patient care, reduced system burden, and enhanced patient and provider satisfaction, make it a compelling model for redefining emergency care. As we continue to refine and adapt this model, It is crucial to engage with all stakeholders to ensure its successful integration into our healthcare systems. This comprehensive nature serves as a testament to the transformative potential of SDEC, offering a template for future innovations in healthcare delivery systems.